నమస్తే, నేను మీ నందకిషోర్ ఫ్రమ్ గమన్ మల్టీ స్పెషాలిటీ హాస్పిటల్స్. ఈరోజు మనకి సౌత్ ఆఫ్రికా క్రికెట్ టీమ్కి 1991 నుంచి 2002 గ్రెగ్
2002, correct.
ఫ్రమ్ 1991 to 2002 వరకు సౌత్ ఆఫ్రికా క్రికెట్ టీమ్కి ఫిజియోథెరపిస్ట్గా విశిష్ట సేవలు అందించిన క్రెయిగ్ స్మిత్ మనతో ఉన్నారు. 2002 తర్వాత ల్యాంకషైర్, ఆ తర్వాత నాటింగ్హామ్షైర్ లాంటి అత్యున్నత క్రికెట్ టీమ్స్ అయిన ఇంగ్లాండ్లో ఉన్న ప్రీమియం క్రికెట్ క్లబ్స్ కూడా డాక్టర్గా ఉన్నారు. ఇండియాలో అజారుద్దీన్, అనిల్ కుంబ్లే లాంటి ఉన్నతమైన అగ్రశ్రేణి క్రీడాకారులకు కూడా వీరు సేవలు అందించారు. అలాంటి అద్భుతమైన వ్యక్తి ఈరోజు మన మధ్యలో ఉన్నారు. హైదరాబాద్లో గమన్ మల్టీ స్పెషాలిటీ హాస్పిటల్లో డ్రై నీడ్లింగ్ మీద వర్క్షాప్ కండక్ట్ చేస్తూ ఉన్నారు. ఈరోజు వారిని మనం పరిచయం చేద్దాం. హాయ్ గ్రెగ్, వెల్కమ్ టు ఇండియా.
Thank you very much.
Thank you for coming and teaching our kids about this wonderful program, dry needling. Would like to know few things from you.
Sure.
First of all, you are such a popular physiotherapist working for all the international players. Of course, you worked for South Africa for more than a decade, but we all know that you helped almost all the cricketers across the globe. What attracted you for a innovative course like dry needling, and how you developed your passion? And what made you to consider teaching dry needling all over the world for young students who are coming up?
That's a very interesting question because I've been practicing dry needling for over 30 years.
Wow.
And did my first course in the early 90s and then got involved with South African cricket. And then wanted to use the technique on the cricketers and found that they were running away a lot. Except for a few of them. A few of them actually didn't mind being needled, but the likes of people like Lance Klusener and Makai Antini were dead set against being needled. But other players like
Zulu,
that's right,
Lance Klusener, I'm a big fan of him.
Yeah. I'm still a big fan of him, and back in the day I was a big fan of him. But then, as you know, I was with South African cricket for 11 years, and then I moved on to county cricket. And dry needling became quite an important part of my treatment strategy. But it wasn't the only part. As you know, you have to treat a player from an all-round perspective, and you have to, as a physio in those days, you were part of the rehabilitation, you were part of the medical, you were part of the stretching, the warm-ups, the training, and the treatment and the rehab. So dry needling fitted to some degree. And then in 2010, I decided to retire from sports physiotherapy. I'd spent 20 years traveling around the globe, having cricket as my calendar, being away from my family and my kids on public holidays and weekends. And I decided that I was going to grow my little business called Club Physio and continue to manage and promote courses around the world. And that's what we did. And one of the courses that we were managing and facilitating and marketing and arranging was a dry needling course. And back in those days, I wasn't teaching, but I was assisting and I was organizing. And it just so happened that on one of our courses, one of our lecturers woke up sick one day. And when you've got a sick lecturer,
you have to still continue the course.
You have to continue the course because people have flown in and they've paid money.
So you got a wild card entry into teaching.
That's correct.
And
it's really, really strange because that lecturer happens to live, and I'm not going to mention any names, but he happens to live in Hyderabad, which is where we are.
See, Hyderabad is lovely.
Figure it out.
You know what?
It's a lovely, lovely guy. And I thought to myself, gee, man, my lecturer can't teach. I need to give him some time off to feel better. I better go down and teach this course. And that's what I did. And I basically winged it. I used all my experience, my knowledge from days of cricket and days of needling, and I applied that to the muscles that we were teaching and demonstrating on that course. Thankfully, in the afternoon, the lecturer was feeling a lot better, so he could continue teaching the course. But for me, it was a wake-up call. It was a wake-up call that this could happen on any other type of course.
A substitute fielder got all 11 catches.
Exactly,
you know what?
Exactly.
Yeah.
So there I was, substitute fielder coming in for an experienced all-rounder, and I had to do the job. And I decided that I was going to formalize my training. And I was going to make sure that if it ever happened again, I could step in and just seamlessly teach the course.
We call that destiny.
Yes, no, you're absolutely right. Yes.
Yeah.
So destiny had quite a destiny and opportunity had quite a large point to play in me becoming a dry needling teacher. And actually teaching has been a vocation in my life that I find natural, I enjoy, and I've always wanted to do. But I've never ever seen myself as a teacher because I was always a clinician. But I always challenged myself as a clinician, especially in sport, to try and do things on a stage where one had to public speak and to teach. And so I presented at a couple of international conferences in the UK, in South Africa, in Sydney, and in the Middle East. And then I came to having to teach. And I started organizing some courses where I was the teacher. And after about 3 or 4 courses, I knew that this was going to be something that I was going to continue to do. Because firstly, I enjoyed it. Secondly, I was getting a lot of requests. And thirdly, I found I was quite good at it.
I know, we see a huge fan following for you.
Oh, thanks very much.
Students.
Yes, thank you.
Well, Greg, you have got so many friends in Hyderabad as well. Along with Mr. Subrailu, he's a huge fan of you and your favorite student, I believe. Other than Dr. Subrailu,
Yeah.
who are your good and strong friends from Hyderabad?
I have a very, very close friend who I see from time to time called Dr. Naveen Kumar, who is a professor at one of your universities. Another friend from Hyderabad, Subaru, you'll have to remind me of. I have the lady who's an assistant on our course. She's a good friend, Gayatri Shetty. Then I have very close friends all scattered around India, like Hemali in Bombay, and Jitesh in Kerala, Bangalore friends. And I don't want to single too many people out because I know that some people will feel a little bit offended if I don't. But I have friends all over, from Delhi to Coimbatore to Goa, Michelle in Goa, Bangalore, Hyderabad. I'm embarrassed to say, because I've been to India probably more than 40 times, I'm embarrassed to say I've never been to Chennai. I don't have any known friends in Chennai that I hang out with over there, but we have had a lot of...
We have so many cricketing friends from Chennai.
Yes. And my favorite cricketing coach, who I'm a very good friend of and who played with me when I was physio at Notts, Stephen Fleming, has been very successful with the Chennai Super Kings. Yes, and...
who is that gentleman?
That is Stephen Fleming. He's a New Zealander.
See, yeah. we all love him.
Yes,
We all love him.
yeah.
Such a gentleman.
Correct, yeah. So, I love coming back to India. I don't know why. This is the country I've visited the most throughout the whole world. I've been to India the most than any other country, probably double any other country. Second is probably the United Kingdom. So I'm hopeful that I'll keep coming back more and more, and especially since your facility here is such a great host, and this is the second time that we're here, and you are making plans to develop this into an educational facility of great substance and uniqueness.
We consider this is a blessing to have all the hardworking intellectual people who gained this knowledge over decades of time are coming here to share.
Sure.
With young people, and always this is such a blessing. See, when I see the history, South Africa and Indian cricketing always had a lot of love and respect among each other.
Yeah.
And we are like huge fans of people like Janty Rhodes, and they are loved as good as Sachin Tendulkar.
Well, South African cricket actually owes India a huge debt, because it was India who suggested and promoted South Africa back into the international fold in 1991, which was why our very first tour, which I was fortunate to come on in 1991, was to India.
We were very young, and we were excited to watch Mr. Alan Donald bowling.
Please do not show any photos or video clips from that tour, because you won't recognize me. I had a big head of brown hair. I was cherubic cheeks. But yes, you're right. Alan Donald bowling the first ball. Andrew Hudson facing the first ball and getting bowled first ball by Kapil Dev. Us losing in Calcutta and in Gwalior, and then winning in Delhi. It was a tour that I will never ever forget. It's actually one of the most starkest, vividest memories in my life, because obviously it played such an important situation. You know, when you arrive in Calcutta and your trip from the airport to the city center takes 6 hours, because the roads were filled with so many people, and we had to stop 3 times to receive garlands and wishes and all sorts of things from the Indian people.
Cricket is a religion in India, right?
We know that, yes.
Cricket is a religion in India.
Absolutely is. I've made some amazing cricket friends. One of them here is in Hyderabad, Muhammad Azharuddin. I got on really, really well with him when he was playing for India. I was very lucky to help and to treat and advise many of the other Indian cricketers like Sachin and Rahul and Anil and Javagal and all those wonderful players from yesteryear. It's lovely to catch up with them from time to time. I have seen some of them around the world. But now my life has moved on and I'm in the educational industry, and we have a great relationship here in Hyderabad, and hopefully we'll be coming back more and more.
One final question before we conclude. Competitive sports, especially like high valued cricketing teams at the national level, we have the challenge of preventing further injury, if possible preventing injury, and also getting athlete back to the competition at the earliest. How do you think dry needling helped you in quicker recovery when you compare with other available modalities we have?
One of the things that I tell the new participants in the course is that when you learn a technique like needling, you learn a technique that can directly affect and treat the inside of the muscle. So if there is something wrong with the inside of the muscle cells, if there is scar tissue, if there is a trigger point, if there's reduced blood supply, we normally treat from the outside. And so you're normally treating in a secondary, passive way. Whereas with needling, you now, as a physio or medical practitioner, have the opportunity to treat directly inside the muscle. And that makes the treatment much more successful. If you do it correctly and you know how to do it, the treatment technique speeds up the recovery for the player. It's something that was demanded by some of the players, especially when I worked in county cricket in England. I turned some of the players from being fearful of needling into accepting needling. It's a technique that is growing throughout the world. It's still in its youth, believe it or not. Even though it's been used 30, 40 years, it's still in its youth by the numbers of people that use it, but it's growing steadily year on year.
Greg, do you like to write a book on dry needling or your experience or on the theory?
I will certainly pen a book in the next year or two, absolutely. Yeah, it's time to maybe travel a little bit less and sit by my laptop and put a book down into words and my experiences and our techniques and do something like that for sure.
That will be a massive gift to all the young aspirants working on.
Yeah.
Sir, one question to Dr. Subrailu. Sir, what attracted you for dry needling, and when did you met Greg Smith, and how you became big fan, and what helped you, and how, in what way you convinced this gentleman to come to Hyderabad and teach all the kids?
I had been to Goa course where I had met another co-instructor, Hemali from Mumbai. So she had an ankle swelling over there. She had a treatment, dry needling with one of the participants over there. So immediately after 5 minutes after doing the dry needling, the swelling gone off. So in that way, I came to know that dry needling was very effective. So I was very much impressed with the dry needling technique and all those things. Through him, I wanted to do the course once again with him in Hyderabad itself. So many physios doesn't know about dry needling, how the technique is useful. So I advised him and I requested him to come down to the Hyderabad course to organize a course and to teach the fellow physios. In that way, I requested him, he came down all the way.
How is the joy experience and how people
It's very fantastic. It's really, fantastic actually to learn the techniques again freshly. To brush up my knowledge once again. It's very fantastic actually.
Thank you very much. Greg, we would like to see you again and again and again here teaching thousands of kids here.
Unfortunately, I think that's going to happen.
Yes. And did you enjoy biryani?
I haven't had one yet, but we are going out to dinner one of these nights. And I look forward to a Hyderabad biryani.
You should not miss sure. Hyderabad biryani.
Hyderabadi biryani, absolutely, yes. Yeah.
Thank you very much.
Thank you very much.
Thank you.
God.
You like to ask anything or say something? Did I miss anything?
No, I just
anything.
I want to extend my thanks and my gratitude to you and to your hospital for providing us with a fantastic facility, for looking after us, for making sure everything is running smoothly. Obviously to my good friend Subu here for inviting me back a second time. Meeting him on the Goa course in August was a great experience. He stood out as one of the standout students. Everyone was talking about his clinic and his biomechanics interest and all the equipment that he has, and I was super impressed. And the cherry on top was when he invited me back, and he produced a successful course in October last year at your hospital, and we decided to try again. And then once again, Subu has created a successful, fully booked course for the room upstairs. So I just want to extend my gratitude and thanks to Subu and to you for your
hospitality. In fact, we are lucky and very much blessed, and I'm pretty sure this is going to go in numbers, because I just wanted to let people know that this has got a lot of evidence backup, and it has got exceptionally good skills, and these sort of techniques are going to help them to deepen their knowledge and improve their options to help the individuals, and especially at this phase of the time where Indian sports are growing, not just cricket. Cricket used to be the religion. But not only that, now there are professional sports coming up in kabaddi, football, archery, volleyball, basketball. Hockey is our national game anyway. So it's like now what we see, that revolution, sports as an industry is actually going to evolve. And at this point of time, people had a lot of respect and recognition for physiotherapists, especially along with their conditioning trainers and skilled coaches. The quality and competitive level is actually growing. And at this point of time.
What I'm so pleased to see is that, for all those sports, they have taken on a professional attitude. They have got their medical teams and then their doctors, their physios, their trainers, their dietitians, their psychologists, data analysts and all that. And that extends not only from top level, but through to the provincial and state teams, and through to the academies and even the state academies, to see that the money is being put into the welfare of the players and the research and the improvement of the looking after the players and making them more resilient, more tougher, which basically means that all the good players are going to be playing as much as possible. So it's great to see that forethought is being
extending the careers of quality players, which is absolutely priceless. Thank you, Greg.
Thank you very much. Thank you, everybody.
ఇది ఈరోజు సౌత్ ఆఫ్రికన్ క్రికెట్ టీం ఫిజియోథెరపిస్ట్గా దీర్ఘకాలం సేవలు అందించిన గ్రెగ్ స్మిత్ తోటి మనకున్న అకాడమిక్ చర్చ. థ్యాంక్ యూ.